Hello everybody, my name is Bonnie and we're gonna start in a couple minutes. I just want everybody to get checked in. If you can hear me, I'm gonna type down here in my chat when you hear me. Please give me a thumbs up. Thank you very much. And once I get everybody in and get their mics checked, we'll get started. And while we're doing that, I'm gonna start off. We're gonna put you on question and answer mode. That means you're muted, and then whenever you want to talk, all you have to do is be sure that you come up here to my mood, and then you can either raise your hand, yes or no, or I'm fine. Just let me know. And then let's do it. Let's do a poll first. That's what I wanted to do. And this question is what I'm gonna ask is, do you know anyone who has or has had oral cancer? And if you want to go ahead and start voting, we'll finish that vote and submit the vote. Now we'll go back to the PowerPoint. We'll go ahead and get started. We're going to talk first about the etiology and contributing factors. I'm going to ask everybody in their private chat to answer. Let's see. Okay, I'm going to have everybody come over here to your private chat, and I want you to answer these questions. In the private chat, I'm going to give you the question, but I want you to do it in private. So what you're going to do is you're going to answer this question in your private chat. Okay? What do you think or know are the top 2 contributing factors to oral cancer? I'm going to have you do that as an individual in your private chat. So you go here to chat, and then it goes private chat. You just click on private chat. Okay? And so the 2 most important risk factors for cancer of the mouth is the use of tobacco and alcohol. Usually they go hand in hand. If you're drinking, you're usually smoking. Out here in the Southwest, smokeless tobacco is a big deal. A lot of people do Copenhagen. I know when I worked in the grocery store, that was a big seller, and that stuff is so expensive. But it is one of the risks of smokeless tobacco, and it's not always good to, it's not a good idea to take your smoking and say, oh, I'm going to quit smoking, and then go to smokeless tobacco. Smoking changes the tissues in your mouth to what we call atypical. So when your tissues are regenerating, it doesn't regenerate correctly, and we call that atypical. And smoking is the single most important risk factor. Cancer of the lip is usually when you spend a lot of time out in the sun, especially here in the Southwest. We are always in the sun. It's always good to use a sunscreen. Another cause for oral cancer is poor oral hygiene. If you knowingly have like periodontal disease, or you're not brushing well, or your nutritional intake is not good. There's also specific viruses that are linked to oral cancers, the link of HPV 16 and 18 strand. What those are those, the HPV, which is human papilloma virus, is linked to cervical cancer, and you can get exposed through oral sex or any kind of exposure to that. It's becoming a real big issue. It actually changes the dynamics of oral cancer because it's not just the older smoker who's been smoking for a lot of years, but it's young men in their 20s and 30s who are getting this specific virus, and it's usually into the back of the throat. And it also herpes, which can be herpes 1 simplex, which is like a cold sore, or herpes 2, which is genital warts. Those links are also, and also congenital and acquired defects of the immune system. If you have diabetes, or if you have like an autoimmune, there's several different types of autoimmune diseases, but thyroid, hypothyroidism is also immune. What happens is your immune system is not working up to par, and that changes how our body functions. Here's some pictures of this is the back of the throat. This lesion is on, like, you can see how far that mirror is down in that throat area. It is on what we call the posterior pillar, and this is on the tongue. We think that some of this stuff doesn't look too abnormal. If you ever bit your tongue, it can look white like this one. But these are all squamous cell carcinomas. It's pretty drastic. I know of a 50-year-old man who just passed away from tongue cancer at the base of the tongue, and he did smoke. So some of the signs and symptoms of the oral cancer is that usually through the early stages it goes unnoticed, especially the type that is for the older male that has been a smoker for a long time, or a lot of alcohol consumption. The oral cancer that is related to the HPV and the herpes virus are actually found earlier because you have actually like warts or a wart-like appearance lesion. There sometimes is hardly any change at all. Sometimes it's just a little white lesion, which we call leukoplakia, or it can be red, which is erythroplakias. And the erythroplakia lesions actually have a higher rate of developing into oral cancer than the white. Another sign is a small indurated ulcer, which is like a hard little lesion in your mouth. A canker sore, I don't know if anybody's ever had a canker sore, but it's fairly common. You see a lot of people with canker sores. Hoarseness for a long time, numbness in the oral facial region, and the persistent earache. And I'm going to give you a link to a video at the end of this presentation to a woman who actually was a fairly young woman at 50, and she had a persistent earache. She did have a persistent canker sore that did not go away. And so it's very important that you have these things, or you notice anything different. If you smoke, it's best to give yourself what we call an intraoral and extraoral. Intraoral is inside your mouth. Lift up your tongue, turn your tongue back and forth, look in the mirror, say ah with your tongue down, and look down your throat. Extraoral is around behind your ears, underneath your chin, and behind on your neck. Radiographs are a way of detection. Delays in diagnosis may be attributed to you, the patient, or me, the professional, or both. teaching the patient the importance of an oral self-examination, how to do the exam, and when to do it, and what may warrant a visit to your healthcare provider. And those things are something that I do as a hygienist and that you will be doing. You know, when you graduate, you'll be giving oral cancer screenings in your daily routine. Also, it's important to stress to the patient that if you have any kind of sore or discolored area of your mouth, anything that does not heal within that 14 days, it needs to be looked at by a professional. Personally, in my 5 years of experience as a hygienist, I've really never seen any cancer. I've seen a lot of different types of lesions. There's a lot of viruses and they can leave lesions in your mouth, but the main thing is that it is gone within that 14-day time period. And we have actually had more than one person diagnosed, but it's just a viral. But it can look pretty nasty, just not even being cancer. Helpful links. Some of these are just some helpful hints that you actually see your dentist for an oral cancer screening or a hygienist, which is what we do. Monthly self-check exams. These, this YouTube video will show you exactly how to give you that oral cancer screening on your own. Something that we know how they tell you to do as a breast cancer exam, you do once a month on a certain day. It can also be that way with your intraoral or extraoral cancer screenings. Also, cessation of tobacco and alcohol products. This is a stop smoking link, which is really important to, you know, learn that there's a lot of help out there. And also, I had a lady that has actually stopped smoking, and she said she did the billboard. I can't remember the name of it, but it's a 1-800 billboard up there, and it does, they send you texts through the day, they send you helpful hints that it really does work, and they give you free products. This alcohol withdrawal hotline link right here is something that's just gives you an idea of actually, you know what, I might be having alcohol issues. And this last one is my my little wrap link that I'm gonna show you on this next paper, but I put it here so you have it on your PowerPoint if you need it. That way you can copy. You can't copy, I can't copy and paste, but you can at least copy it or take a picture of it. And so these are my references, and I sure appreciate you. So we're gonna close this, and I'm actually gonna show you my other little application. I gave you an image of the inside of the mouth and where you need to be looking for these, we call the warts, they're a wart-like appearance. You will see them down in the throat area, way in the back. This is your hard palate, your soft palate. This is your little uvula that hangs down. And then your tonsils. Some people have tonsils, some people don't. And this posterior pharyngeal wall, that is where most cancers of men that smoke like for years and years, and women also. And then your tongue, and you need to make sure you be checking your tongue. So this is my application. I actually did step out of the box and I made me a Google drawing, although because I can't present it ahead of time right now, this is my web link, and this is also my little web link to my ladies presentation. I'm running out of time, so I need to take one more poll. I'm actually gonna say, does this presentation inspire you to take action in the prevention of oral cancer? So we're going to say yes, and we are going to be done.